So we have a little bit of an agenda today, doing some welcome, a little bit of Zoom instructions, and then why is this important? Why are we doing this now? And what is our framework? Then we're going to move into an overview of what Pursuing Equity is and what this initiative is, a little bit of information from a past Pursuing Equity participating team, some instructions on next steps to apply, and then we'll have an open Q&A. So at this point, I assume that we're all very familiar with Zoom, but if you're not, here's some instructions on how to rename yourself. If you are on a browser, feel free to put in your company or your pronouns, whatever information you want. Or if you logged in through someone else's account and need to update it, that has happened to me more times than I can count. We'll be monitoring the chat throughout today. So if you have any questions that come up at any point, feel free to pop them in the chat and we will note them down and then circle back to them at the Q&A. So if at any point anything comes up, feel free to pop it in the chat and we will make a note of that. And now I'll pass it along to Rebecca.
Thank you so much. So welcome everyone. Thank you for being here. Thanks for your interest in equity, racial justice, and pursuing equity. Before we dive in with more information about Pursuing Equity, I wanted to welcome our faculty member, Dr. Ron Wyatt, to share a couple opening words. Dr. Wyatt is an author of Pursuing Equity's foundational framework. He's faculty for our initiative in the past and in this coming iteration. And he previously served as the Chief Quality Officer at Cook County Health, the Hamad Medical Corporation, and was a Patient Safety Officer at the Joint Commission and co-chaired their first Health Equity Leadership Forum. So we're really happy to have him involved and that you get to hear from him today. So Ron, I'll kick it over to you.
Okay, thank you, Rebecca and Hannah. So I just first say welcome to you all. And I suppose I should restate that since I'm in Alabama, we don't say that, we say roll tide. So I'll say roll tide to each and every one of you. So as you see that the questions there on the screen and what I would say as you think about the work in equity and the time that we're in right now. What becomes most important, I think for all of us, but especially for me, having grown up in the segregated South, in Perry County, Alabama, in what's called the Black Belt. And I say that because just 2 days ago, there was a published report from the state of Alabama that said that on any given day, 9% of the children in Alabama go without food. Lowndes County, Alabama has been listed by the World Health Organization essentially as the equivalent of a developing country. So before I get to the whys of it and the what of it, I always take us back to the who of it. And the who of it are the people that we serve. The who of it are people that have been under-resourced, marginalized, and left behind unnecessarily to be harmed and to hurt and to suffer premature death because of systems that have been structured to get those results for over 450 years. So what we're dealing here then is with a system that came out of slavery, that went into emancipation, Reconstruction, Jim Crow, mass incarceration, deep child poverty that leads to, and I'll quote Don Berg from the time that I was at the IHI, when he said that in the US, an independent risk factor for death is racism. So I say that because I go back to about, I think, 2014, when I challenged IHI in a big meeting to say that while we do all of these strategically wonderful things, and while we set out to change the world, which is what this is about, we need to think about the ground we stand on first and how we begin to change the ground we stand on first as an IHI. So back then, even I issued a challenge to IHI, and it was not that the work was not already taking place, because the IHI board had already begun to discuss diversity and equity and what we now call inclusion that led to the Pursuing Equity 1.0. So for me, it starts with who are we doing this work for? And can we, in a genuine, authentic way, commit ourselves to the who we do this work for? Then it becomes, why is it important? Some of that I already laid out to you. And I typically say, there's no need for additional research to try to prove what the things I've just said. There's plenty of research that proves it. This becomes important now that we can change this, and we have the ability to change this. Why now? It is urgent, and it's been urgent for a while, but when you think about the confluence of catalysts, which includes the death of Breonna Taylor, the killing of George Floyd, the unveiling of inequity that COVID wrought, that again speaks to the sense of urgency of now, and the hope and optimism that needs to be sustained so that we can be successful in this work. So as Rebecca talked about, back in 2016, me and just a wonderful group of people wrote the Achieving Equity White Paper. And I won't go through all that framework, but a couple parts of that is that we began to build a strategic plan to address equity as a systems related challenge. The other part in there is that we began to address how we become truly transformative around being anti-racist. And you'll see the rest of that framework in the white paper. Hopefully you'll get a chance to read it if you haven't already. And then that brings us to, again, this moment in time. You see the screen there of the white paper. So that brings us now and to you. And I will say, since I've been here since Pursuing Equity 1.0, there were topics even then, and that was, I guess, maybe 5-6 years ago, that were uncomfortable. There were words that we were reticent to use. And 2.0, we began to address and be specific about what this work is about, and the power structures and white supremacy and anti-racism and how communities can benefit from this work. And we started to bring in senior executive leaders from organizations and ask them to commit to this work. So that brings us to this moment where now this work will continue. We know that the Joint Commission will ask all of us to do some of this work as a part of accreditation beginning in January. I'll share with you that probably 80% of the Joint Commission standards, I wrote them. It aligns well with this work. The CMS, what are now called social drivers of health measures. I made public comment on those, that we began to, first of all, make a commitment, have a strategic plan around equity, use data analysis, data validation, and quality improvement and leadership to achieve health equity. And I would say to eliminate inequity. The next part of that is to address those social drivers of health: food insecurity, transportation insecurity, interpersonal safety, utilities insecurity, and the things that we describe as social determinants of health. So that brings us to this moment, and it's a change the world moment. And typically what I hear is, well, I'm one organization, I'm a small organization, I'm one person. How in the world can I change the world? And my response to that is always the same. If you can save the world, save and change the life of one person, then you change that person's world. So what brings me to the last thing I'll say is, yes, and the folks at IHI know what I'm going to say next. Yes, this is hard work. It's absolutely hard work. But when you think about the work that we do and why we do it and who we do it for, it is hard work. So for those of you that are interested, you will commit to hard work. It will not be easy. It will challenge you. But I truly invite you that if you are ready to take that step and to change the world of one person, then I would invite you and your organization to look at this initiative and what you bring to it and what you will take from it. And I will stop there. Thank you, Rebecca. Thank all of you.
Thank you so much. Very inspiring and a helpful grounding in who we're doing this for and the hard and the heart work that's required, and that we hope you'll all kind of take with us in this journey. So let's dive in. We're going to give a quick overview about this 18-month initiative, the Pursuing Equity Initiative, which takes place from January 2023 to June 2024. We'll try to make it quick because we know there's lots of information in that request for applications document, and we do want time to kind of go over your questions and answers. So next slide. Skipping ahead a little bit, but as we get back to the slide, I'll just share Pursuing Equity overall. We're designed to foster systemic action in health systems to achieve improvements in equity and really become liberated in racial justice efforts. We really hope to do this by building community, building trust, promoting a communication system between teams to help support learning. Hey, I tried this, it worked, let me try that. Build connections, build relationships. We want to connect teams with subject matter experts in equity, racial justice, and improvement science to help support their efforts. And as IHI, we want to lead alongside of you all dissemination plans that can publicly highlight what we learn so that others can continue these efforts as well. And finally, we want to leverage improvement methods and tools in the work. IHI, one of our special sauces is quality improvement and improvement sciences. So how that fits in and ties together and holds hands with equity. Next slide. So this approach that I just described applies to both cohorts that you can choose from. So there's a learning network and an action community. We kind of designed two cohorts to really provide you all a chance to think about what stage you're on in the equity journey, what kind of targeted support you need, and be able to pick the right effort for you. Both of them are free to join, thanks to a grant from Genentech, who's a member of the Roche group. And the cohorts vary in size. So the learning network is a bit bigger with 40 participating teams, while the action community has 10. They differ as well in their goals, the types of supports and activities, the application processes, and we're going to dive into all of that later in this call. One last thing I'll say, both do include participation in Racial Equity Institute's groundwater training, and there's also an optional meetup for both for anyone who happens to attend our IHI Forum, which is a conference that we hold each December. So that optional meetup will be in December 2023. So on the next slide, as you think about which of those two cohorts might be best for your team, you might be wondering, well, what is a team? This word we keep kind of throwing out there. When you think about a team is really comprised of 3 to 7 individuals, all who are ready to improve equity and racial justice, commit to dismantling white supremacy culture. We want your team to be diverse in terms of race, ethnicity, gender, sexual orientation, and also a multidisciplinary representation. We'd love for your teams to include individuals with a lens on data, quality improvement, equity, patient-facing care. All those lenses will really help you be successful and have the right players in the room. And lastly, we need teams that have full support and sponsorship from their executive teams. It's really difficult to do this work and to be successful without that backing. So that's something that we really hope the teams that apply will have. One other thing I'd say, this program is designed specifically for healthcare delivery organizations. We really want to help those organizations, improve the culture of equity at their organizations and improve clinical equity outcomes. If you are on the call now, you're really interested in this, you're committed, and you're not a healthcare delivery organization, that's okay. We recommend that you partner with a healthcare organization. You can work together, apply together, and participate together. And I think that would make your team even stronger, honestly, to have partnership involved. One other thing I'll note about teams before we kind of dive into the cohorts. This initiative was designed with US-based health systems in mind. So much of our work will center on the history and the systems of racism and other forms of oppression in the US specifically. Additionally, our activities will be scheduled to accommodate Eastern to Pacific time zones. So that being said, we do think this is kind of designed for US teams. However, we think other teams, granted with those 2 caveats, from other countries would benefit. So we really welcome you to apply if you think you could make the time zone work, and if you kind of acknowledge that a lot of the discussions of history and such will be based on the United States. We can answer more questions about all of that in the Q&A, so keep them coming in the chat. For now, we can go to the next slide and I'll hand it over to Catherine to share more about the Learning Network.
Great. Thanks so much, Rebecca. And hi, everyone. My name is Catherine Mather. I'm a Senior Project Director here at IHI. And I'm going to just talk a little bit more about one of the cohorts, the Learning Network. So the Learning Network, as Rebecca was just saying, is the larger cohort of teams that we're going to assemble as part of this iteration of Pursuing Equity. And this group will be working together to really commit to learning the tools, building and practicing the skills, and obtaining a deep understanding of equity and racial justice so that they can bring that back to their organizations and their communities. What you see here on the slide right now is kind of just like in broad strokes, a map of the activities that we have planned during the 18 months of this work. So as Rebecca just said, one of the first things that we'll do with this cohort is start with training from the Racial Equity Institute, their groundwater training, which really aims to set a foundation for equity and anti-racism work and kind of level sets for all of the teams that are selected to participate. From there, we'll kind of fall into a cadence of every other month. So on one, starting in January, and then every other month from there, we'll have all team virtual meetings, which will really be learning and discussion-based virtual meetings where folks can kind of share what they're working on. We'll offer some suggested activities and strategies and concepts. And this will get a great opportunity for folks to kind of learn from the larger group together. On the alternating months, we'll be offering group coaching virtual meetings, and these will probably, we're estimating about 4 or 5 cohorts that will divide kind of based on a number of factors, including, but definitely not limited to, things like regional distribution, the population served by the healthcare organization, the organization type, perhaps even the size of the organization. And during those coaching calls, that'll be a chance where you'll be working with coaches to kind of dive deeper, potentially bringing specific problems into the coaching calls, and doing some relationship building with smaller cohorts of kind of similar organizations. So if we go to the next slide, please. We can just talk a little bit about what an organization who enrolls in this could expect in terms of outcomes. So as I was saying, this learning network is designed to help the teams kind of build their infrastructure and advance equity across their systems and move towards improved results for specific clinical equity areas that they've identified. And 18 months, depending on where folks are kind of arriving in terms of their journey, may or may not be enough time to produce dramatic equity-related improvements across the systems. But we do anticipate that learning network teams will achieve the outcomes that you can see here. So developing that deeper understanding of and ability to acknowledge their organization's history related to racial justice, and increased fluency, I think, first among the team that's joining, but then also throughout the organization for identifying structural equity issues across the organization. An increased capacity and capability to apply an equity lens to each organization's data to better understand the current state and really use that as a jumping off point to identify opportunities for improvement. We are committed to kind of working within the coaching cohorts to identify one or more clinical areas, once you've done that deeper dive into data with inequitable outcomes to allow you to kind of focus your work and learn in that area. This will look like developing some key aims to advance improvements in inequitable outcomes. And also, ultimately, toward the end of this time together, we're hoping that the teams will identify a set, or sometimes we use the language of a portfolio of projects to support their equity-focused improvements in a specific area, clinical area, and ultimately set the infrastructure to think about that system-wide. Go to the next slide, please. So those are the expected outcomes, and we wanted to share what some of the expectations are for teams that are participating in the learning network. Attendance is a big one. This will all be virtual, so hopefully that will make it a little bit easier for folks to attend, but we really want to prioritize attendance by the core project team to all of the learning network calls. There's also an expectation that the team that's doing this work is really committed to advancing the understanding of and their action to remediate inequities on multiple levels. So really ready to do that deep heart work that Dr. Ron was just talking about, and committed to naming and explicitly addressing racism within the system. It's also an expectation that, we'll practice the value of all teach, all learn, and share transparently with other organizations that are participating in the Learning Network, and really take the time to formally reflect on progress, challenges, and learning on a regular basis. And finally, we have the expectation that, teams that are participating in the Learning Network have the full support of their leadership, and that the senior leaders in the organization are in support of the efforts, and also the time commitments that are required throughout the engagement in the 18-month Learning Network. So that's an overview of the Learning Network cohort. Please do keep any questions coming in the chat, but I'll now hand it over to Dorian Brooks, who's going to talk about the Action Community.
Thanks so much, Catherine. Hi, I'm Dorian Burks. I'm an Improvement Advisor and Equity and Culture Lead at IHI, and I'll be one of the Improvement Advisors and coaches for the Action Community. And so the Action Community for Pursuing Equity is kind of that amped up next step from the Learning Network. It's going to be a select group of 10 teams. And so we do have an application process for this to go really deep into advancing and improving outcomes around equity. We expect that you come in with some strong team participation and some usable data and some understanding of your current state, and some work that's been done in this area in order to really dive into this Action Community with success. We'll go over some more of those outcomes and expectations in a bit, but here's some of the activities you can expect. So the team will be going through the REI groundwater training as well alongside the Learning Community. There will be one-on-one coaching sessions. So you'll be working with someone that is skilled in improvement as well as in equity work to really work alongside you through the full 18 months of this work to help you advance in and work through all the challenges and opportunities you'll find in your projects. There's going to be 3 opportunities for longer learning sessions. 2 of them will be actually in person in Boston at or near our IHI offices. And so that'll be a great time to build community across these 10 teams and learn and practice. We'll have ongoing team calls every other month, alternated with group coaching calls as well, where you will continually get to share ideas, some of them perhaps specific to different topic areas or clinical outcomes that you're working on. Then we'll be asking teams to join racial justice affinity groups based on their racial and ethnic identity. And so in these, we recognize that in order to do the deep systemic change work to advance equity, we have to understand what we bring to the work and our own biases, our own processes of healing, and understanding our own interaction with the systems and structures. And so the racial justice affinity groups will help us do that personal work that will help us show up even more authentically in our teams. And lastly, there will be a leadership work group as well, where especially those at the leadership level and those interacting with the leadership level will be challenged to think about how to strategically align this work with your organization's mission and how to engage and challenge your leadership as well to continue advancing equity. On the next slide, we've got a few of the expected outcomes for this work. So we expect that most organizations will see progress towards their desired clinical equity outcomes at the project level that they identify for this work. We will we expect some organizations to see progress on process measures at the population level. So being able to start spreading some of the learnings that you've had at your project level to work across your population. We also expect some organizations to see hopefully greater results going to scale with an intervention or demonstrating the ability to sustain improvements over time. All participating organizations will build capacity to measure and move health equity results for the long haul, including a long-term plan to take your work to scale. And all participating organizations will demonstrate the capability to close equity gaps. On the next slide, there's a few ideas of who should apply. So as you'll see, compared to the Learning Network, this is a bit of a step up. So we encourage those to apply who have the heart, motivation, and commitment to do this radical racial justice and equity work. The organizations that have already taken some time to really build the understanding that racism and other intersecting forms of oppression are systems issues. This isn't something you're questioning, but something you understand are ready to tackle. We'd love for you to have existing partnerships with community organizations that will help you support this work. We expect some knowledge and capability around quality improvement and hopefully some measurable results from previous QI initiatives. And importantly, we will be asking for you to have currently accessible and usable race, ethnicity, and preferred language, and hopefully some SOGI data as well to measure progress towards your equity goals. We know that that can be often a barrier to moving forward in working towards clinical outcomes. So we ask that you have some progress and available data to start this work. And then on this next slide, we've got a few expectations as well for our action community. We expect our team to participate in all of the meetings over the 18-month period, for individuals to join one of the two racial justice affinity groups, to be sharing your learning challenges and data generously and widely across the action community as we seek to truly be a learning community together. You'll be identifying one senior leader to really take ownership of this work with you, as well as an alternate senior leader to be able to participate in the bi-monthly leadership calls. You'll be committing to advancing your understanding of and action to remediate racial inequities, committing to boldly naming and addressing racism explicitly, and to continue to contribute to dissemination to the field and to potentially our learning network as well in partnership. So that's a little bit about the action community, and I'd love to pass it off to Rebecca to continue our overview.
Thank you so much. So as we mentioned before, both cohorts are free. However, we invite you to consider the costs that your team should be ready for. So one is people resources. You know, there's time in the activities that my colleagues outlined, as well as time outside of the activities and the calls and the meetings. We recommend that teams meet once a week to kind of keep up the momentum of their work, you know, time testing some efforts. We really want you to kind of not only attend our calls, but put them into practice outside of calls as well. Next, you should be compensating any people with lived experience of inequities, such as patients of color that engage with your team. So that's a cost that you should consider. Next, we ask that all individuals on your team do the internal work that's associated with putting yourself out there, being vulnerable. All that's really necessary to actually making improvements and doing this work right and doing it well. So the time, energy, and effort in doing that is really important to us. And finally, for the action community only, those 2 in-person meetings that Dorian mentioned, the teams who attend will cover their travel, the flights, lodging, and transportation for those 2 meetings. So let's pause here. I'd like to invite Maha Razaki, Quality Program Manager of Member Equity, Inclusion, and Diversity at the KP Washington team. They were a past team on our last iteration of Pursuing Equity, and I invited Maha here to share a little bit about their team's experience. So I'll hand it over to you.
Thanks so much, Rebecca. I try to turn my video on. Is that coming through?
Yep, it's coming through.
Awesome. Thanks so much. It's so great to be here, and I'm really excited to share a little bit about our experience. I know I just have a few minutes. I could probably talk about it for an hour. So as Rebecca was mentioning, I work with Kaiser Permanente Washington. I'm based in the quality department, and I'm a program manager for Member Equity, Inclusion, Diversity. So I oversee our language access programs, our health equity initiatives, and our ADA civil rights. And I actually entered into this work after it got started. So a couple months into it, one of my colleagues left for a role for a different team. And I'd been involved in some capacity, but not in like the PM capacity. And you know, my experience with the IHI had been back about 20 years ago in college when I'd learned about them. I had never imagined an opportunity where I'd get to participate. So it was really a dream come true for me in many ways, just really getting to go from like the academic learning to actually implementing. So in terms of our project, some of the elements that we looked at were our data dashboards, because we had incorporated health equity filters into our various dashboards, and we recognized that our Latinx population had an increased gap in their diabetes outcomes. And so through that, we identified our strategic goal to work with a community health organization to see what learnings we could apply in our work and test out if our members could participate in one of their classes. And our clinical project was to improve the blood sugar control through engagement of our population, and really understanding ways in which we could tailor our care. So a few examples of the progress we made during the initiative: we're testing changes through a PDSA framework, really starting small before expanding. Prior to this work, there'd been a goal set by Kaiser National where they look at all the regions and the gaps, and you get a fairly short amount of time to impact those metrics, but we conveyed to our leaders that some of those metrics we might not be able to meet, and really created a case for starting small. And we got so much help from the IHI frameworks in order to create a meaningful message. So we started sending a message to 100 patients after convincing our quality leadership that, you know, we couldn't send it to everybody before testing out. And we're really glad we did, because we got 0 responses initially. So that told us we had to change our approach. And it made it clear that we needed to test out with a smaller group and not make assumptions about outreach tactics we'd use for other care gaps and programs. We also looked at how we could improve our patient-centered approach. We had certain tools and resources that we had implemented, but then we increased our regular meetings with the community health educator partner to learn about their classes. Unfortunately, there was turnover in that position, so we were not able to fully partner, but we continue that relationship to this day, and we're looking into how we could provide opportunities for our patients to have an opportunity to join those classes. So that was also the flexibility in terms of learning, knowing that sometimes things won't go exactly according to plan. But in terms of testing our outreach modalities, we saw greater than 10% improvement in enrollment, which doesn't sound like a huge number, but kind of given the constraints that we had and the gap that we were experiencing in this population was meaningful by adding a secure message rather than just sending a cold call to a patient. So just to backtrack, our population health team was overseeing this program. And when a patient had an A1C of over 8, they would be eligible for this particular program. And so their workflow as a nurse was to call the patient, and oftentimes you can't reach the patient because they're at work or busy. And so there were a lot of voicemails left, but we noticed that when you sent that message to them through our platform, that they were engaging more. And there were a lot of different things that we tested that were part of this initiative that went well after we had the support of our coach, who I see is on the call today. We worked with Kevin Little, and he was so instrumental in helping us really look through what our assumptions were and how do we avoid assuming that a particular modality, particular initiative that worked for a specific population would automatically improve care. And that's something we knew intuitively, but oftentimes from leaders, if they see that especially a tech-based solution is working, and they do want to replicate that for other populations. So how to really meaningfully pause in that exploration to make sure that we aren't creating and being prescriptive of different solutions before really engaging in a small capacity in testing before we invest. So the IHI meetings that were described earlier were incredibly helpful. The groundwater training, really understanding the ecosystem of everything that impacts the care that patients receive outside of your organization and how that can be bidirectional. And then the coaching calls that I mentioned really helped expand our critical thinking skills, the types of questions we were asking. And to this day, I keep trying to think through some of the lens that our coach provided for us in all the different work and projects we do. So I know that I'm probably running short on time, so I'm going to skip over a few points, but really there's probably not enough that I can say about the impact this had on our work. And I did have some learnings along the way that I'd like to share. We started out with the PM role that I mentioned earlier that I stepped into a couple of months after initiative, and we decided to create a very wide range of diverse stakeholders within our team to ensure that we were touching upon every single department that could contribute to this work. So including our nutrition department, our medical group leaders, providers, clinical folks that worked in this specific diabetes space, as well as our quality and operational leaders. And to really expand the impact of this work, it is important to ensure that there's enough representation from the beginning of your design process as much as possible, and understanding your own ecosystem within your healthcare organization to see where there might be peripheral impact, where there's core impact, but what may contribute to any of the disparities that you're noticing in your data. And also another thing I really relied on was encouraging different perspectives during internal meetings. I think so often we tend to agree with the majority. It can be uncomfortable to voice questions, but when you do attend the IHI meetings, they provide this really safe space to think of things critically. And a lot of us come into it with lived experience. And so we've lived through it, but it might be uncomfortable to bring it up in your organization, to call out, white supremacy, racial injustice, but hearing the ways in which it can be framed in the organizational setting really helped us. I mean, we as an internal team already spoke that way, but we knew that thousands and thousands of employees, everyone's at a different comfort level, but we still need to really identify what our institutional barriers are and how we're replicating that and what we can do to improve that. So encouraging your project team to share their input regardless of how different it might be from the way things have been done. So exploring just new modalities, new ways of thinking, again, really testing small. I can't say enough about that. I think our coach really instilled that in us, because we get so lost in trying to make these large changes that sometimes we can go through that and realize that that solution's not working. So that might, be a year that you spent on that particular approach, only to find out later that it wasn't as impactful as, someone hopes that it would be. And understanding your organizational constraints. So for folks that take on the PM role, I know for me, I was super eager and I just wanted to do it all. And then really realizing that, my intuition about certain things at the beginning, in terms of community partnerships, I was really mindful that I didn't want to strain community partners who already have so much on their plate and with limited resources, helping patients. But folks in our team, understandably, myself included, really, really wanted to partner with them and make it work. But knowing that it's okay to say, this was our plan and right now it's not working, but what might we do differently? How can we still leverage some learnings and then rediscover new ways of looking at this problem, or how can we come back to this in a way that does not strain someone else's work or their resources? So I'll pause there because I might be over time, but I again just really want to encourage everybody to explore this opportunity. It's been one of the highlights of for me of last year. And I remember I was leaving on maternity leave and it was the last week and I was so excited that I could participate in our final call with all the teams. And I think the last thing I'll say is that having the collective experience of meeting people from other organizations that participate and having that bi-directional learning happening where you can share what you're seeing in your organization and you're hearing at the same time how folks are approaching any of their challenges or goals and redefining their purposes is really powerful. And it sets kind of a new way of evaluating what you might be working on currently and what you might want to explore in the future. So I really want to thank everyone for joining today. And thanks so much, Rebecca, for reaching out. I'm happy to answer any calls answer any questions or, jump on a call with any of you if you wanted to learn more about our work. So Rebecca, feel free to share my information with anyone attending today.
Wonderful. Thank you so much for taking the time to join today, to share about your experience. Kate has a question for you in the chat, if you wouldn't mind chatting a response back, and we will definitely connect you with anyone that has follow-up questions. Thank you again. Emma, do you want to go over this one last section, then we'll dive into the Q&A?
Yep, happy to. If I could get the next slide, that would be perfect. So I'm just going to speak very briefly to the application process. So it is a little bit different for each community. So for the Learning Network, we're going to require an online application as well as a letter of commitment from the CEO. And for the Action Community, we're going to require both those things as well as a letter of commitment from the CEO and board chair and a video submission from your team. The deadlines also differ a little bit. So the Action Community deadline is going to be a little bit sooner than Learning Network, just because it takes us a little bit more time to review those applications. So that is going to be due on Friday, October 21st. And then the Learning Network applications are going to be due on Tuesday, November 1st. On the form, which you'll see pictured on the right, you're going to be asked to indicate which cohort you're interested in applying for. And we do want to emphasize, if you apply for the Action Community and are not selected to join the Action Community, you will be considered for the Learning Network. So don't fear, we will absolutely consider you for both. Yeah, so that is my quick and dirty rundown of the application process. And I'm going to hand it over to Catherine, who's going to take us into the Q&A.
Yeah, thanks, Emma. So feel free to keep the questions coming, but I've been trying to capture them along the way so we can run through, but keep them coming in the chat. Or if you'd prefer to kind of speak it out loud, you are welcome to use the raise hand feature and we can take you off mute. So the first question that I saw in the chat was around whether there has to be more than one person from an organization. And this person was saying that they're from a small organization and they're the only person who can commit. So I think the answer is we are looking for teams of 3 to 7 individuals, but Rebecca, do you mind if I hand it over to you to speak to that a little bit more?
Yeah, absolutely. So we have had teams in the past that had 1 or 2 people, and from their experience, we've kind of come to this recommendation of 3 to 7 people. I think it's helpful to have more colleagues than just yourself to help move tests of change forward, help navigate different barriers. It's really hard to kind of make this systemic change in your organization as just one person. So just in order to kind of recommend how we think you'll be successful, we recommend applying if you can kind of gather a couple more team members. If Dorian or Kevin want to say anything else about that from your experience in the last iteration, feel free to chime in.
Yeah. Hi, can you hear me?
Yep.
Hi, good afternoon or good morning. Kevin Little. So I've served as an improvement advisor for the last 2 cycles, and I'm honored to be working on cycle 3 here with my teammates at IHI and Dr. Wyatt. For the project team, you do have to think about, and this is related to another question that came up about clinical topics. I think one of the participants said, gee, our clinical people are just so busy. Maybe we ought to be thinking about an HR policy project or something. Our intent is a clinical topic. I think we could certainly talk with you. If you tell us that that's just impossible, and I guess we can have a conversation about it. But what we've seen in the past, of course, is that the people who initially perhaps get on the call might be in support staff. It might be somebody from the diversity, equity, and inclusion office, might be attending one of our calls, might get excited and get some colleagues to apply. But then most of our projects in the past have had a clinical focus. So then we're looking at some combination of a clinical lead or an administrative and data quality person who may be also engaged. So when we talk about team, I think, Rebecca, you're mentioning somebody and some small group who's going to be actively engaged and our point of contact. But almost surely there's going to be, if we're successful, it's going to be more than 3 to 7 people, right? So if you're working on a service line, you're going to be working however you organize improvement projects in your institution. There's going to be some cycle of meetings, something like chartering, data review. So there will be some impact. So if your organization is going through, you're changing from Cerner to Epic this year and other things, it just may not be the time for you to do that. I think we can talk more, but team is core team that's going to be engaged and regularly on our calls and so forth, but almost surely you're going to be, if you're successful, working with a larger number of people. And so I'll leave it at that, and maybe other colleagues from IHI would comment.
Thanks, Kevin. I think that's really helpful, just to hear kind of the history of your experience with the last offering of pursuing equity. There were a couple other questions around kind of timelines and support after the end. So one person asked, will those who start in the Learning Network be able to join the Action Community in later cohorts? And then there was another question about, will there be any support after 2024? I think for this offering, whether you are enrolled in the Learning Network or the Action Community, that is kind of going to be your cohort for the next 18 months. And as of right now, we don't necessarily have a next offering planned. I mean, I think really just because we're so focused on getting this one off the ground right now. So I'm not sure that I can answer that exactly at the moment. In terms of whether there'll be support after 2024, I think that's one of the great benefits of this kind of learning community, whether you're in the Action Community or the Learning Network, is building those relationships with peers. And I think a lot of folks who participate in these kind of programs do stay in touch with colleagues or with their coaches, but there won't be formal coaching, all team meetings after June 2024 related to this effort. But let me pause for a second and see if any of my colleagues want to add to that. All right. So the next question I have was from Corey Davis. They were saying that their organization is in the study of the system relationship building phase of Equity Improvement Collaborative within their state, Michigan, and that design phase aligns with much of what the learning health system model will look like, but likely won't begin until halfway through 2023, and just had some concerns that this opportunity isn't necessarily aligned with their timeline, and wondering if we had any advice on that.
I'm happy to jump in. So I'm wondering if, so although we will be ambitious, I think, in thinking about our clinical outcome projects for the Action Community, there could be an opportunity to scale a small version of what you might be doing in the Equity Improvement Collaborative as a whole, to start, and use it as kind of a way to test a pilot project through the Action Community. So if you'd like to think about kind of in your application detailing what that might be, that's something we could definitely take into consideration and discuss more as we receive the application. Other colleagues have anything to add?
No, I just reiterating, Dorian, I love how you were outlining there might never be a perfect time or something that's perfectly aligned. So how can you just dive in and let what's available help inform the work that is in a different timeline, I guess.
I want to support that. And in all of this, we ultimately hope that having a view of your work, your clinical work, your service, as Dr. Wyatt said, the people that you are in existence to support and provide care to, that this is not a special project, but you're already working on hypertension, cardiac care, infection control, outreach. If it's primary care, you're working on vaccinations. All of those could be viewed, should be viewed from a position of equity and racial justice. And so you've got work going on right now. Your clinical people are very busy doing stuff. So what would it mean to have an equity lens to that work? So that's another way of thinking about it. And our colleagues at Kaiser, it was a relatively small cohort. We were talking in the hundreds of people. That was their focus. And so they've got more patients than that. And after they worked with their Latinx community, they were also working on another demographic group that the leaders had determined. So you can start anywhere and demonstrate progress, help people whose lives will be better. And if we are learning, we ought to be able to apply those lessons more broadly. So I think we're open, as Dorian said, to a lot of stepwise learning. You could start with a very focused population, service line, one group, one hospital, one clinic. That's fine. We often say to do that anyway. So no problem from my perspective.
Great. So another question in the chat was around dissemination and just a little bit more detail about what we mean when we're talking about contributing to dissemination in the field. So what we're thinking with that is, just being willing to share your experience and learnings through things like IHI blog posts, presentations, whether through IHI or through other local opportunities, case studies, sharing summary reports with the Learning Network or Action community and potentially even more broadly, and also potential media outlets or media opportunities that might come up as a result of this work. So some openness there towards dissemination. But Rebecca or Dorian or Kevin, anything you would add there?
Nope, just the goal is to spread all the good ideas, the learnings to others that can benefit from it. I would say all teach, all learn. So whatever you learn, we want to teach to others and vice versa. So that's the goal. And of course, anything that goes kind of out into the world would be worked on with you and vetted by you and your organization.
I'll add to think of this as a provocation, and also to imagine, as Dr. Wyatt said, doing this work is hard, it's challenging, and we will not be perfect. I am not perfect at this work. I make mistakes. And so one of the things that's very useful, we have our colleagues from Hartford Health who published a study. They were in our last cohort. And one of the things that I admired so much was they talked about how the error they made in their vaccination policy rollout among staff during COVID and how they recovered from that. So I hope, as we think, I know this is always challenging. Organizations never want to say what they're doing is less than perfect, but we're not perfect. And so I'd hope that we could begin to think about what we could share, certainly among ourselves in this community, where things don't work, and we learn more from the things that don't work if we're reflecting carefully and be prepared. So think about what it might look like to tell your story, that's not just so perfect that the marketing people are all smiles.
Thanks, Kevin. Yeah, I would sometimes like to think about it like failing forward. So failing fast and then failing forward and learning from things that maybe didn't go quite according to plan. So there were a couple travel questions. I think Rebecca answered them in the chat, but I want to just reiterate here that while participation in the program is free, thanks to sponsorship from Genentech, for those organizations in the Action community, the travel to the 2 in-person learning sessions will be something that your organization will need to cover. Someone else also asked whether the entire team is expected to attend the learning session. I think that kind of depends on the size of your team. I think we were envisioning 3 to 5 folks from each team joining in person. But yeah, so that would kind of depend on how large your team is. Let's just scroll down a second. Sorry. Oh, okay. So there's one question around the Learning Network projects. Do we recommend limiting teams to focus on one project at a time versus, more than one concurrently? I think I'll offer my answer and then see if any of my colleagues want to jump in. I think usually we would encourage kind of starting small and starting with one project, but to the extent that you have the capacity and capability to do so, kind of scaling up to a portfolio of projects as the Learning Network goes on. But let me pause for a second and see if my colleagues have any thoughts.
And yeah, I think what I would add to that is for the Learning Network, the work will be, I think I chatted in a bit, so I'll try to expound on that, but it will be mostly foundational. So it's more about kind of getting yourself ready to do clinical based projects as well, and build that focus and understanding of your current system and what's needed to apply a structural equity and anti-racism lens to your work. And so by the end of the Learning Network, you'll have a set of aims and a portfolio of projects identified to begin launching your work. But the Learning Network, as opposed to the action community, is more on that learning side versus focused on a project. Other colleagues would add anything?
Thanks, Dorian, and sorry I had missed your chat response when I was going through the questions. So I'm afraid we've come to the end of our hour together. For those of you, I know there are a couple questions we didn't get to. We are going to be pulling this all together into an FAQ, which we'll distribute to folks who registered for this call and also put up on our website. But I think we have one closing poll that we want to put up.
So I just launched a poll. It should pop up on all of your screens. Feel free to select. This is just us gathering a little bit of data. And then while you answer that poll, I'm going to go ahead and share the link to our website where we have more information about our white paper that we talked about today, guides for each of the components of the framework, and summaries of past Pursuing Equity work.
Yes, we duplicated the first option, so you can vote once. Thank you, Maria.
Oops. Thank you for catching that. Not sure how that error happened.
Thank you all so much for being here, taking the time, even just being interested in this and being stewards of equity and racial justice at your organizations. We truly appreciate it. Any questions you have, you can email our inbox and we will follow up with that FAQ. So thank you all so much. We hope to see you apply and see you in one of the 2 cohorts. Thank you
all so much.
Thanks, everyone.